A 2025 study found that people with total knee implants activated airport metal detectors more often than people without an implant. Screening equipment and procedures vary, so tell the security officer that you have an artificial knee before screening begins. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. Robert was about 5 months out from his total knee replacement when he started planning a flight for his granddaughter's graduation. About a month earlier, after his surgeon had cleared him to fly, he had taken a short trip to visit his brother. He underestimated the airport walking, hurried after a gate change, wrestled a heavy carry-on into the overhead bin, and chose a window seat. He drank very little to avoid the airplane bathroom. By the time he arrived, his knee felt tight and swollen, and he was too worn out to join his brother for dinner at one of his favorite restaurants. This time, he wanted a plan that would leave him with the energy to enjoy his granddaughter's graduation. Robert is fictional, although his experience is based on the kinds of travel problems people describe after knee replacement. We'll follow what he changed for the graduation trip from his front door all the way to the destination. This is the second episode in our 4-part travel and outdoor activity series. Episode 101 covered road trips. Today we're focusing on flying because an airport and an airplane come with their own set of challenges. Episode 103 will cover hiking, followed by cycling in episode 104. By the end of this episode, you'll have several practical points to consider as you plan a flight and decide what you need to ask your surgeon or medical team. The first question most people ask is, how soon can I fly? I wish there was one simple answer, but the research doesn't give us one date that fits everyone. A 2023 review looked at the advice provided by surgeons, airlines, and travel insurers after hip and knee replacement. The recommended waiting periods ranged from 14 to 180 days. That is a huge range, and it shows how much the answer can change based on the person and the trip. A 2025 review in JBJS Reviews came to a similar conclusion. The timing depends on how recently you had surgery, how long you'll be traveling, your mobility, your medical history, and your personal blood clot risk. A 2026 systematic review and meta-analysis included 7 studies and almost 25,000 surgical patients. When the studies were combined, the researchers didn't find a definite increase in blood clots among people who flew close to the time of surgery. That is encouraging, although the evidence has important limits. All 7 studies were retrospective. The results had wide confidence intervals, and the people who were allowed to fly may have been healthier or lower risk to begin with. Individual studies have reported different findings. One found a higher blood clot rate among people who traveled by air around the time of lower limb joint replacement. Another found low rates in selected hip and knee replacement patients receiving their usual preventive care. The evidence still cannot give one person a flight date. When you ask your surgeon about flying, describe the actual trip, the dates, flight length, connections, ground travel, and return date. Remind the office about a previous blood clot or any recent health change, especially if the person you reach may not have your full chart in front of them. Also, check the airline's current policies before you buy a ticket. Some airlines may request medical documentation after recent surgery, and travel insurance policies may have exclusions or additional requirements. It's much easier to learn about that information before you pay for a ticket than at the check-in counter. Look at the full travel day. A 2-hour flight can become part of a 10-hour day once you include the drive to the airport, early arrival, security, time at the gate, baggage claim, and transportation after landing. A connection adds another terminal walk and another boarding process. The return trip may also feel different after several busy days away. Many airports are quite large, so you may need to walk a long distance from the curb to check-in, then to security, a train or shuttle, and finally the gate. Sometimes the gate changes after you've already crossed the concourse. That was one of Robert's biggest surprises on his earlier trip. By the time he reached the new gate, he had already used a lot of the walking capacity he hoped to have after landing. If you're unsure whether you can comfortably cover that distance, consider wheelchair or electric cart assistance through the airport. It can save your walking and standing capacity for the bathroom, boarding, and the activity you traveled to enjoy. Ask where the service begins. Search each airport's name plus accessibility before your trip. These pages often explain wheelchair arrangements, parking and shuttles, terminal maps, restrooms, and step-free routes. Cincinnati's airport provides step-by-step directions and indoor navigation. Denver recommends arranging wheelchair service throughout the airline at least 48 hours ahead, while Atlanta allows requests during booking or at the ticket counter. Check every airport on your itinerary because the process can differ. Wheelchair assistance and help with security are separate services. In the United States, TSA Cares can help travelers with medical conditions or mobility limitations understand the screening process and request a passenger support specialist. TSA Cares does not provide the airport wheelchair, so arrange that part through the airline or the airport. Give yourself some extra time. Shoes, luggage, an assistive device, and a busy terminal can slow things down. A little extra time lets you move at a comfortable pace instead of hurrying through the crowd with one eye on your bag and the other on the departure screen. Keep your boarding pass and flight details easy to reach. Many people use the airline app on their phone. I would also consider a paper copy, especially if your phone battery is low or the airport Wi-Fi is having one of those days. Keep your identification, medication list, and important medical contact information in a light personal bag that stays with you. People also ask whether a knee implant will set off the airport alarm. It can. A 2025 study found that people with total knee implants activated airport metal detectors more often than people without an implant. Screening equipment and procedures vary, so tell the security officer that you have an artificial knee before screening begins. An implant identification card may be helpful, especially for international travel, but it doesn't allow you to skip screening. Depending on the equipment and your mobility, you may go through advanced imaging, a walk-through detector, screening with a handheld device, or a pat-down. If standing without your cane or walker is difficult, tell the officer before your device goes through the scanner. Ask for a chair or another stable place to hold while it's out of reach. The same goes for removing shoes or walking through the equipment. Explain what you can safely do before the process begins. Now, let's talk about luggage, because having too much to handle can wear you out before you even reach the gate. Robert remembered how awkward he felt balancing while lifting his carry-on during the earlier trip, so he decided to check his larger suitcase this time. A rolling suitcase is usually easier than carrying a bag, although you still have to guide it over carpet, thresholds, ramps, and crowded turns. Four-wheel spinner bags move easily on smooth floors and can roll away on a slope. Two-wheel bags follow behind you and may pull you to one side. Use the style you can control without changing the way you walk. The overhead bin can be another problem. Lifting a heavy suitcase overhead takes balance, reaching, and enough control to handle a bag that may shift as you lift it. Checking the larger bag or traveling with someone who can lift it may be a better option. A flight attendant may be able to help, but airline policies and crew responsibilities vary. Keep the smaller bag light enough that you can handle it throughout the day. Pre-boarding can give you more time to walk down the jet bridge, put away your belongings, and get settled before the aisle fills. Ask the airline how to request it. Use the larger airport restroom before you enter the boarding line, since pre-boarding also means you may be seated longer before takeoff. If you use a walker, crutches, cane, or wheelchair, confirm how far you can take it and where it will be returned after landing. Label anything that will be gate-checked and remove loose accessories that could fall off during handling. Seat choice can make a real difference. Robert chose an aisle seat for the graduation trip because the window seat had made him reluctant to stand or use the bathroom on his earlier flight. An aisle seat usually makes it easier to stand and reach the bathroom, although your aisle side leg is closer to carts and other passengers. A window seat keeps you away from the aisle, and you have to move past the people beside you whenever you get up. Think about which knee was replaced, how easily you can stand from a low seat, and how often you expect to move. Seat pitch is the distance between your seat and the seat in front of you. More seat pitch usually gives you more room to change position, even when you cannot fully straighten your knee. Bulkhead rows may have more open space with personal bags stored overhead during takeoff and landing. Exit rows have emergency responsibilities and may be inappropriate if your mobility is limited. Check the aircraft and seat map before booking because planes vary within the same airline. Once you're in the air, change your position when you can. Your surgeon or therapist may have already given you simple movements to use while sitting. When the seatbelt sign is off and the crew says it's safe, you may be able to stand or walk briefly. Turbulence can happen quickly, so follow the crew's instructions and return to your seat when asked. Movement and hydration may support comfort and circulation. Continue following the blood clot prevention plan your medical team gave you. A venous thromboembolism, or VTE, includes a deep vein thrombosis and a pulmonary embolism. Knee replacement temporarily raises that risk, especially closer to surgery, and long periods of sitting may add concern for some people. Keep taking your medications as prescribed. If you have any questions about this, absolutely contact your physician. If you'll cross time zones, ask your pharmacist or prescribing clinician how to keep your dosing schedule on track. Make sure you follow your physician's instructions. Carry medication in its labeled container in the bag that stays with you. Compression garments also need to match your medical instructions. If your clinician recommended compression, use the correct length, size, and millimeters of mercury. More pressure can cause problems. If a garment rolls, bunches, digs into your skin, or creates a painful pressure area, stop and check the fit with the clinician who recommended it before wearing it again. The compression socks sold in airport shops are still compression products, even when they're displayed beside travel pillows and snacks. Follow the fluid recommendations that fit your health. People sometimes drink less because they worry about the small bathroom, the aisle, or asking seatmates to move. That can leave you thirsty, lightheaded, or even constipated. Robert tried it once and planned for the bathroom this time. Fill a bottle after security, use the airport restroom before boarding, choose an aisle seat when it suits you, and go before the need feels urgent. If you have heart, kidney, or fluid restrictions, continue following your healthcare provider's plan. Airplane bathrooms are small, and standing from the toilet may be difficult. An aisle seat shortens the route. When the seatbelt sign is off and the aisle is calm, take your time getting there. Use the handholds provided and avoid pulling on the door. During a connection, use the larger airport restroom even if the next gate looks close. A gate reassignment can turn a short walk into a long one. Your knee may feel tighter or look more swollen during or after the flight. A small pillow can support your back or help you change your position, but avoid continuous pressure behind your knee. Using cold packs on the airplane can be awkward because cold packs may leak, lose temperature, or be restricted. Check the current security and airline rules before packing them. For many people, using clinician-approved cold therapy after arriving at the hotel is easier. Compare connections by total travel time, expected walking, and available assistance. A short layover can leave you rushing between terminals. A long layover gives you more time and adds more sitting. A direct flight removes an extra boarding process, but it may keep you in the airplane seat longer. For international travel, check medication documentation, entry requirements, airline medical policies, travel insurance, and access to medical care at your destination. Carry the generic names of your medications because brand names may be different in another country. Read the travel insurance policy carefully because recent surgery may affect coverage. Your travel day continues after the plane lands. You may still have a long walk, baggage claim, a shuttle, a rental car counter, and a hotel check-in. Arrange assistance through the arrival airport if you need it, and let someone else handle the heavy suitcase when help is available. If you plan to drive a rental car, make sure you've been medically released to drive and can safely control an unfamiliar vehicle. At the hotel, ask about elevator access, the distance from the entrance to your room, toilet height, and the shower or tub. If your clinician recommended cold therapy, ask whether you'll have access to a refrigerator or freezer. Put your suitcase on a luggage rack or another stable surface so you aren't repeatedly bending toward the floor. For the graduation trip, Robert chose a direct flight, arranged wheelchair assistance, checked his larger suitcase, and booked an aisle seat. He used the airport restroom before pre-boarding, kept water within reach, and stood when the crew said it was safe. His daughter managed the rental car and hotel luggage. He arrived with enough energy to have dinner with his family and attend the graduation the next morning. The earlier trip had shown him where the day could get away from him. This plan helped him protect the part of the trip that he cared about the most. Pay attention to symptoms during and after air travel. New pain or tenderness in one calf, unusual warmth or discoloration, or a sudden increase in swelling in one leg warrants prompt medical guidance. Sudden shortness of breath, chest pain, fainting, coughing blood, or a rapid unexplained heart rate requires emergency evaluation. The purpose of planning is to help you get back to the people, places, and activities you enjoy. A wheelchair through the terminal, an aisle seat, a checked bag, or a little more time between flights may help you spend more of your energy on the reason you wanted to travel. Optional travel items discussed today, including rolling luggage, a small support pillow, and a refillable water bottle, are linked in the show notes. When you're walking through a large airport, this is also a good time to use the techniques in my book, Walking Like Yourself Again After Knee Replacement. And if you need something to read on the flight, there you go. The paperback and Kindle editions are linked in the show notes. Some links in the show notes are affiliate links, which means I may earn a commission if you purchase through them. Thank you. For ongoing practical education, join the free Total Knee Success Insider. I share new podcast episodes, helpful knee replacement education, and selected resources. You can sign up totally free at totalkneesuccess.com. In episode 103, we'll continue the travel and outdoor activities series with hiking after knee replacement. We'll look at hills, uneven ground, trekking poles, footwear, trail choice, backpack weight, fatigue, and how to decide when it's time to turn around. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.